last time we talked about the human skeleton, where we were able to identify the different parts of human skeleton. And we made mention of one of the longest bone in the body, and which is what? Say it. The femur. Thank you. So here I have the femur. This is the femoral bone, and we're going to critically discuss this femur today. And what is the femur all about? This is one of the longest bone in the body that helps to bear body weight, or that is a weight bearer, and also helps in production of red blood cell. So looking at this bone here, it has three regions. It has the proximal region. This is the proximal region. This is the shaft, and this is the distal region. So at each of these regions, it has their specific parts. So let's look at the proximal region. At the proximal region, we have the head. This is the head. And if you look very well, you see a notch in that head. That is the volvus. This place helps for the arteries to pass nutrients to the head of the femur. And this head of the femur feeds the acetabulum of the ilium. And here the head will have the neck, and we have, here is called the greater trochanter, and here is the lesser trochanter. This is for the proximal region. Then here is the shaft. The features you see in the shaft at the anterior region is different from the features you see at the posterior region. We'll look at them one after the other. Then at the distal end, or the distal region, we'll have here the epicondyle, intercondylar fossa. Okay, so here is filled of the synovial fluid, the bursa, and the rest of them, and the ligament, the cruciate anterior ligament that helps to hold the patella together so that it will not move out from the fossa. Okay, then at the posterior region, if you're looking at the posterior region, you will see there is a line here from the lesser trochanter, and there is a line from the greater trochanter. So these two lines here comes together. This is known as the pectineal line, and here is known as the gluteus line, the gluteus tuberosity. So this pectineal line here, it helps for attachment of the pectineal muscle, and here is for the attachment of the gluteus maximus. So these two lines move down and forms what we call the linear aspera, and the linear aspera comes down at the distal end and bifurcates into two. And this one is known as the medial condylar line and the lateral condylar line. And here we'll have the condylars, the epicondylars. So at the anterior part, this is the anatomical position of these femur. So when you look at the anatomical position, if you are being asked that, know that the head of the femur lies medially to the body, okay, and the surface of the shaft is convex while the posterior is concave. Okay, so that is all about the femur, and the muscle